Good morning. Hi, I'm Dr. Baker, and along with a bunch of other medical folks, we're in here Monday, Wednesday, and Friday to deal with medical needs. And a couple of times a month we get together and talk about some stuff about addiction. Last week we talked about the genetics of addiction and the biochemistry and what goes on in your brain. And for those of you who have not heard that talk, we'll be doing it again in a few weeks. Sorry? Thank you. Today we're going to talk about pharmacotherapy, and that is a fancy word for what are some of the things that we can use medication-wise that can improve the likelihood of you being successful in your recovery, that improve the likelihood of you staying clean and sober. And so initially there's this, I don't need any drugs, I'm okay, I'm going to do this. But just have a listen and think it over, and at the end you can decide whether or not any of these make sense for you. And we're going to break them down into categories. We're going to talk about each group of drugs separately and what we can and cannot use within those groups. A lot of people dying of overdoses these days. You know, the fentanyl problem is not getting any better. In fact, despite all of our best efforts, safe injection sites and Narcan kits, the general tendency is for the death rate, the overdose death rate, to actually go up. And a lot of people are dying of drug overdoses. In fact, North America wide, Canada and the States, at this point in time, 2019, it's about one person every 10 minutes. And so in the time that we take to talk about this stuff this morning, another 6 people will have died of overdoses. And that's got our attention. But the reality is that alcohol, as a drug, kills more people every year than fentanyl and all the other drugs put together. Fentanyl, heroin, cocaine, add them all up, and alcohol still hurts more people than all those drugs put together. We don't talk much about booze. And the reality is that cigarettes kill more people every year than alcohol and all of the other drugs put together. So we get real excited about fentanyl, and so we should, because it's a big problem. But we kind of don't talk about booze and we don't talk about cigarettes. So we're going to start with the most deadly drug of them all, tobacco. Because tobacco kills more people every year than all the others. How many smokers die from smoking-related diseases?
1 and 2.
Pretty damn close, 2 and 3, 1 and 2. The number is significant, exactly. You know, I used to smoke, and many of you in this room smoke. There's a bit of a tendency to say, someone else will get the lung cancer, I won't get that, I'll be fine. And we play that silly game of denial, as we so often do. But roughly 1 and 2, 2 out of 3 smokers will die prematurely. We all have to die eventually. But 2 out of 3 smokers will die sooner than they have to because of smoking. And we all think of lung cancer as the major cause of death with smoking, but actually it's heart disease and cardiovascular disease, stroke, heart attack, these sort of things are what cigarettes do the most often. How many people in this room smoke? Yeah, so, you know, roughly 10 hands went up. And so roughly 6 of you are going to die sooner than you have to because you're smoking. So you want to think about that. You did not wake up one morning and come here to the treatment center and say, I'm getting clean and sober today, let me in please. It was a process, you know, maybe it started a year ago, maybe it started 5 years ago or longer, you know, and you say, I gotta do something, I gotta do something. I'm drinking too much, I'm using too much, I gotta do something, I gotta, you know, and it was a process. And eventually the day came when you said, I'm doing something. Start that process in your head about smoking. Even if you think you don't want to quit right now, start to entertain the thought of why you should quit. How much are they a pack these days? 13 bucks or something like that? $16. They're damn near $1 a cigarette. So it's a good reason to quit. They stink, they turn your teeth yellow, they kill you. You know, there's really nothing good that any of us can say about smoking. Even when we did it, even when we enjoyed it, you kind of have to admit that it's a dumb habit. It's more than a habit, it's an addiction. So start that process in your head. Start thinking about quitting, and one day you'll do it. If you never start thinking about it, I promise you, you'll never do it. Quitting smoking is difficult. It's not easy. It will never be easier than it is today. You know, you're in a safe environment, you're in a supportive environment, you're in an environment in which it's difficult to smoke, and this is going to be the easiest time for you to quit smoking. We make it hard here. We have a little area up there for the guys to smoke and another little area up there for the ladies to smoke. We don't let you sit down when you're smoking. We don't let you take coffee or anything else out there because we're trying to help you quit. If you do something that's enjoyable, your brain says, that was good, do it again. I enjoyed that experience. It's fun, let's do it again. And so what we're trying to do is break down the smoking. If a cigarette is a time to sit down and relax and BS for a little while and have a cup of coffee, it creates a lot of enjoyment and you're going to want to do it again. And so what we are attempting to do by having those restricted smoking areas is to make it less enjoyable. You don't get to have a coffee with your cigarette, you don't get to sit down, and if you're not smoking, you should not be in that area. It's not a social pit, it's a smoking pit. Smoke your cigarette, get your fix, get out. Okay? The whole reason is to try and make smoking a little less positive. So you're less likely to continue doing it and more likely to think about quitting. So the day has come when you said to yourself, okay, I'm ready, I'm going to do something. There are a number of things that we can do to increase the likelihood that you will successfully quit smoking. And many of these you're familiar with already. So, what are you addicted to when you're smoking? Nicotine. What's the best cigarette of the day? The morning one. The first one. I know that's what you meant. So the first cigarette in the morning is the best one. Why? Because you're treating nicotine withdrawal. Most of us don't smoke while we're sleeping. We don't wake up at 3 to have a smoke, and so we wake up at 6, 7, or 8. Our nicotine levels have fallen off while we're sleeping. We're in nicotine withdrawal. We have a cigarette. It feels good by treating the nicotine withdrawal. So we can use that fact, that information that we know to help you quit smoking. We can find a way to get you the nicotine that you're addicted to in a safer manner, because nicotine is not an especially dangerous drug. What's dangerous is the smoking. Smoke is bad for your lungs. Cigarette smoke, forest fire smoke, exhaust smoke, it's all bad for your lungs. Some of it is hard to avoid. So, how can we get the nicotine into you without using cigarettes? The nicotine patch is one example. So you put a patch on in the morning, and the nicotine goes through your skin into your bloodstream, and it gives you a steady supply of nicotine all day. And your brain is a lot less likely to say, I want a cigarette, because you've got nicotine in your blood and the brain is kind of fooled. And so patches have about 36 hours of nicotine in them. If you live in British Columbia, you at this time get 3 months of free patches. If you're an Alberta resident or some other province, I'm sorry, you don't. Although many of your employment plans will cover the patches. But if you live in BC, you're entitled to 3 months of free patches a year. And you can actually stretch that to 6 months of free patches, because there's about 36 hours worth of nicotine in a patch. And so you put the patch on in the morning, and you want to take it off at bedtime, because if you leave it on all night, you're going to sleep fitfully, you're going to have crazy dreams, you're getting too much nicotine. And so you take it off at bedtime and you put it back on in the morning and it falls right off. It's hard to get it to stick the second day. It will actually work for 2 days, but it's hard to get it to stick the second day. The second day, you have to use the heel of your hand and you have to rub that patch for about 2 minutes. The pressure and the heat and the pressure and the heat will eventually reactivate the glue, and it will stick a second day. So you can actually get 6 months of free patches. You don't have to use them for 2 days, but it's a little trick to save a few bucks and get 2 days out of them. Yep.
I've used medical tape over them, and it seems to work.
Yeah. I mean, what's important though is that the patch has close contact with the skin, that it's stuck to the skin so the nicotine goes through. So you can use a tape or something over it to protect it, but if you just tape the patch on and it's kind of hanging loose on the skin, it won't work very well. The nicotine won't get through the skin. Yeah, exactly. Yeah.
If you just use a heat gun or
Yeah.
a blow dryer, warm it up, that'll loosen the glue again. And then that'll, yes.
But pitch careful with that technique though, because too much heat will release the nicotine too quickly.
Oh, okay, yeah,
Okay,
that
so,
makes sense.
yeah, but your principle's right, as long as you do it in moderation.
Yeah.
You can do it a lot more safely by using your hand because you can control the heat.
Can you put it anywhere?
Yeah, it says to put it above your waist, it doesn't matter. Skin is skin, it doesn't matter where you put it. Okay, yeah?
Should you take it off before you exercise?
You get sweaty, it'll be really hard to put it back on. I would leave it on.
It's not bad for your heart rate.
Yeah, I mean, yes it is. Technically, nicotine is a stimulant, as caffeine is. It raises your heart rate, but if you're a smoker, you're giving yourself zaps of nicotine every time you have a cigarette, and you've survived it. So, it will say on the patch box probably something, I don't know if they still have it on, but they used to have a warning of don't smoke when you're using these. Well, the reason is that you'll get too much nicotine, but what does it feel like if you get too much nicotine?
It's sick.
You get sick. It's terrible. Exactly. You'll stop real quick. You'll realize that this is not cool and you'll stop. So I wouldn't worry about, I'd leave it on while I was exercising unless it's very close to bedtime and you're going to take it off anyways. Yeah. So the nicotine patch gives you a nice steady supply of nicotine. It takes away the craving to smoke and it makes it easier to quit. Addiction is a complex behavior. Craving is only a part of the solution. It's only a part of the problem. But it makes a big difference. People who use patches do a lot better than people who don't use patches. So if you're using the patch, you're still going to find that there are times you want a cigarette, like first thing in the morning, because you put the patch on, it takes a little while to work. Like after a meal. Like after certain other things. There are times when you're used to having a cigarette. And the trick then is to use a quick release nicotine. So either the nicotine gum or the lozenges or the spray or the inhaler. There are a variety of these products out there. And that gets you that extra hit of nicotine when, despite having the patch on and despite doing everything that you think you should be doing, you still get that urge to have a cigarette. And you can give yourself the nicotine and almost guarantee take the urge away. How long does a craving last? Yeah, 1 to 2 minutes. About 45 seconds is the answer. So it'll pass. It feels like it's going to last forever. It feels like it's lasting forever. But in reality, it'll pass in about 45 seconds, a minute, 2 minutes at the outside. So take your extra nicotine and just be cool for 2 minutes and it'll be gone. And however you take the extra nicotine doesn't matter. So gum, lozenge, spray. If you use the gum, it's not really nicotine gum, it's nicotine resin complex. And if you chew it like gum, you will be uncomfortable. So when you smoke a cigarette, you don't go. What happens if you do? You get sick. So when you're doing the gum, think of every bite or two as taking a drag on the cigarette. There used to be a TV commercial years ago called Choo Choo Cheek. And you give it a couple bites and then you cheek it, because a couple of bites on the gum is like taking a drag on a cigarette. You're releasing some nicotine and then you cheek it. If you stick it in your mouth and chew it like a piece of gum, you're going to release the nicotine too quickly. That will give you a sore throat, heartburn, and hiccups. And so if you're getting sore throat, heartburn, and hiccups from the gum, it's a good sign that you're chewing it too quickly. And so they developed the lozenge, which of course you're supposed to suck on and not bite, and that slows the release of nicotine. It's a little less easy to abuse that. The spray is probably the neatest one. You just spray it under your tongue, and as long as you don't go psh, 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 like a crazy person, you won't get more nicotine than you need. And then they have the little plastic inhalers. There are a lot of useful devices to give you nicotine in a patch on a regular basis through the day, and then as a supplement, quick-acting nicotine when you need it. It works well, especially when you use both of them. It works really well. Yeah.
I put on the patch for about 5 years, but what I found, I can't remember what the instructions were. I think stage 1 was a month or whatever it was. And I went to stage 2 and I got wicked cravings, so I went back to stage 1 for like another month, and then it seemed to kind of work.
Yeah, so the patches come in 21, 14, and 7 milligrams of nicotine. How much nicotine is in a cigarette? About a milligram. So we used to think that they were kind of equivalent. They're not. it takes more nicotine in the patch to give you the equivalent of what you were getting from smoking. And so if you're smoking more than 5 or 10 cigarettes a day, you probably want to get on the 21 patch, and you probably want to stay on that for at least 3 months. How long does it take to break a habit? At least 3 months. Okay, at least 3 months. So if you're going to use these things, figure on using them 3 to 6 months. Nicotine isn't that harmful. The patch, the gum, the lozenge, whatever form of nicotine you're using is far safer than smoking. And if you use nicotine gum for 2 or 3 years to successfully quit smoking, that would be fine. No one ever went back to smoking because they used the nicotine supplements for too long. Lots of people go back to smoking because they use them for a month or two, they think they're okay, and they quit using them, and boom, they're back to smoking.
Sorry to interrupt.
Not at all.
My life insurance through Sun Life, I guess I quit 1.5 years and started again last summer, but it's double the rates for my insurance. But I thought, because I was using the spray, I thought I'd be a non-smoker because you have to quit for 1 year. So I was reading the fine print, and you have to quit all nicotine substances, because what they do for a test is a urine test for nicotine, and it takes about 30 days to get out of your system. So I was surprised. I thought, okay, I'm a non-smoker, but they say all sources of nicotine.
Well, the test that they use cannot distinguish between smoking and patches, because there's nicotine in your urine. So you tell them you're using the patch, but they have no idea whether you're really using the patch or the cigarettes, and so that's why they have that.
They say you're allowed 1 cigar a month.
Yeah, that's kind of them, but probably best. It's like so many things. The easiest one to say no to is the first one. Yeah. So we can significantly improve the likelihood of you staying clear of tobacco, which is the drug that kills most people, by using the patches and the gum. There are some other things we can use. A number of years ago, we developed a medication to treat depression called bupropion or Wellbutrin. And it works pretty well as an antidepressant, and a lot of patients use it to this day to treat depression. But you know, surprisingly, people were coming back and saying, you know, I don't even want to smoke anymore. Well, that's because you were smoking because you were depressed. Well, yeah, but the other antidepressants treat depression, but you don't give up smoking. And so it was an accidental discovery. Many things in medicine happen by accident. Viagra was developed to treat high blood pressure. It works, but it doesn't work any better than other drugs that we already had. Just no one would give it back. And so a lot of times we discover things by accident. This drug that was developed, and is still used to treat depression, was found to somehow take the craving away to smoke. We were really hopeful that it would take a lot of other cravings away when we stumbled upon that. It didn't. It works for tobacco. It doesn't work for other drugs. So Wellbutrin works to take away the cravings. Some insurance companies will pay for a medicine to treat depression, but they won't pay for a medication to treat quitting smoking, because they call that a lifestyle change. And so we have it in 2 names. We call it Wellbutrin if you use it for depression, and we call it Zyban if you use it to quit smoking. Same pill, same factory, everything's identical, just 2 different bottles. And so usually we write Wellbutrin because usually you're a little bit depressed, and that way you can get it covered. So Wellbutrin works well to take away the craving to smoke. People that use this drug, about 1/3 of them are successful in quitting smoking. And so this is something else to consider, Zyban or Wellbutrin. We knew that Zyban worked. It was an accidental discovery. This drug was supposed to be for depression, yet it helped people quit smoking. What is it about this antidepressant that helps people quit smoking that isn't present in all the other antidepressants? Because the other ones don't work for smoking. And that's where Champix came. So we sort of figured that out, what part of the molecule is working best for quitting smoking, and we refined that a little bit, and we came out with a drug called Champix. And Champix really isn't used to treat depression, it's used specifically to help you quit smoking. And it's more effective. It's about 30% more effective than Zyban. Now, if you've used Wellbutrin or Zyban in the past and it's worked for you, use it again. But if you're going to pick one from the beginning, de novo, and say, well, which one should I use? Probably the Champix, because it works better. You can combine many of these things. You can take Champex with a nicotine patch, a nicotine gum, and you can really improve the likelihood that you will quit smoking. It's like not guaranteed, but it's getting close. You know, the vast majority of people that do this are successful. You can be as well. So for the time that you have remaining in this center, think about it a little bit. Start to think about quitting smoking, what that would be like for you, why you wouldn't choose to do it, why you would not choose to do it now, because it will never be easier than it is today. You've got lots of support here, and we make smoking a little bit more difficult. So give it some serious thought. Any questions on the smoking stuff before we change gears? Okay, so we've talked about tobacco addiction, and we've talked about some of the things that we can use to improve the likelihood that you will give up your tobacco addiction. And that makes sense. You heard enough about this, you've known enough people, and they say, yeah, that's true. What he's saying is real. We have medications that work for many of the other addictions, and we're going to talk about them one by one. The next one we'll talk about is alcohol. So is alcohol addictive? Yeah, a lot of people addicted. Are there medications? So for years we've been trying to come up with medications that would treat addiction, and we've had limited success. There is no pill that takes it all away. The first medication that we came up with to help people quit drinking is called antabuse. Antabuse is a medication that you take that does nothing. It's like Rice Krispies, you know, you put them in the bowl and they just sit there and look at you. You pour milk on them and they snap, crackle, and pop. Antabuse is a little bit the same way. If you take your antabuse every day, it does nothing. You don't feel different, you don't act different, nothing happens. But if you drink when you're on antabuse, you will feel lousy. So when you have a drink, it goes into your stomach and very quickly to your liver, and your liver breaks it down. It goes from alcohol, and it's broken down to acetaldehyde, and then it's broken down to carbon dioxide and water and all kinds of other things. And those breakdowns occur by enzymes. So you have chemicals in your body that do jobs, that do work. They're called enzymes, and they promote a certain action. And so alcohol dehydrogenase breaks alcohol down to acetaldehyde, and then acetaldehyde dehydrogenase breaks down the acetaldehyde. It's complicated. Take notes. There's a test at the end. Yeah. What does acetaldehyde sound like?
Formaldehyde?
Formaldehyde, because it is kind of like formaldehyde. And so how antabuse works is it blocks this step. So you have a drink, your body breaks it down to acetaldehyde, and what should happen next, almost instantaneously, is your body, your liver would break down the acetaldehyde, and you would not get a buildup of acetaldehyde in your blood. However, if we block that step, the acetaldehyde levels in your blood go up. Acetaldehyde sounds like formaldehyde for a reason, and your body does not like it. And so your heart will start to go pitter, patter, patter, and your face will turn red, and you'll get a headache, and you will feel miserable halfway through the first drink. No one drinks on antabuse twice. Lots of people try it once. Most people don't try it twice. If you don't drink, nothing happens. But if you drink, you will get sick long before you get drunk. It's a useful tool. It's not going to cure addiction. You simply forget to take it, you forget to refill your pills, and you're drunk again. But you know, a lot of times we'll get up in the morning and we'll feel motivated. Today I'm quitting smoking. Today I'm starting my exercise. Today I'm going on my diet. Whatever it is in the morning, I feel motivated. And as the day goes on, it's like, flip, I'll do it tomorrow. You get up in the morning, you take your antabuse, your decision is made. You can't unmake that decision. You only have to say no once, first thing in the morning, swallow the pill. It actually takes about 4 days for the antabuse to get out of your system, so you're not getting drunk for a few days. So it's a useful tool. It's an especially useful tool when you're in high-risk situations. Maybe you're going to a wedding and there's an open bar and you know there's going to be great pressure to drink. Maybe you're going to a family reunion. Maybe you're going to Mexico 2 weeks, all inclusive, and the booze is free, and they're always going, beer senor, beer senor. So you take your antabuse every morning, and you just have to say no once. You can't drink. It's like you're allergic to alcohol. You will get sick if you drink. A useful tool in some situations. Yeah?
I was just gonna ask, can we request that?
Of course.
For you?
Of course. That's why we're talking about this morning.
Just a tool that we can
Yeah.
have, so it's something that I can hold on to, like, if I don't use it for the next year.
Use it whenever.
Okay,
Yeah.
awesome.
Yeah. Why would you not take antabuse?
To give yourself opportunity.
So you can drink.
Yeah.
Yeah, exactly. And hopefully you don't want to do that, which is why you're here. So, you know, you'll hear people say, oh, that's a crutch. You don't need that. You shouldn't use that. You're being weak. If you broke your leg, would you use crutches for a while? Of course. And after a while, eventually your leg would get stronger and you'd switch to a cane and then you'd give up the crutches. There's nothing wrong with using these tools to improve your odds. You don't wear your seatbelt because you're a bad driver. You wear your seatbelt because you know you can have an accident. You use these medications because you know relapse happens. And I want to make it less likely to happen in me. And so we have antabuse. Antabuse is a deterrent. It makes you sick if you drink. It doesn't really
So it's not addictive, is it?
No, none of these things are addictive. Wouldn't give you anything addictive.
No, because you know how you mentioned like it motivates you and
Yeah, not addictive. Totally safe to use. So antabuse is a deterrent. It doesn't really take the cravings away. It kind of does, because if you know you're going to get sick when you drink, yeah, you don't think about drinking very much because it makes you sick. But technically speaking, antabuse doesn't take the craving away. So we have a number of other drugs, and it's one of these accidental discoveries again. In the late 1970s, we developed a medication called naltrexone. Whoops. Naltrexone was developed to help heroin addicts stay clean. How naltrexone works is you take the pill and it dissolves and it goes to your brain and it blocks all the parking spots in your brain where heroin would normally park and exert its effect. So if you're a heroin addict and you want to stay clean, you get up and take your naltrexone. You actually only have to take it 3 times a week for heroin addiction. So Monday, Wednesday, Friday, you take your pill. Now you can't get high. It doesn't make you sick if you try heroin. Doesn't necessarily even take the heroin craving away, but if you go out and use heroin, the heroin will do nothing. And that's not much fun after a while, 20 bucks wasted. And so it's a useful tool to help heroin addicts or opiate addicts stay off opiates. But you know, after a while, some of them will come back and say, I don't even want to drink anymore. And it was like the Viagra, like the Wellbutrin, it was an accidental discovery. This drug that we had developed to help opiate addicts stay clean, somehow seemed to take away the urge to drink. And we're still not entirely sure how it works, but it does. And so naltrexone is one of those medications that takes away the urge to drink. Does it work? Yeah. How do we know that? Well, we go into places like the downtown east side in Vancouver, and you put signs up on the telephone poles, wanted volunteers to study alcoholism, $25 a day. They line up at the door. That's good beer money. And there's only 2 things you have to do to be in this study and get your $25. You have to show up every morning and swallow a pill. And the pill is numbered. You don't know what's in the pill, we don't know what's in the pill. They look identical, but some of them are naltrexone and some of them are fake. They look like naltrexone, but there ain't no naltrexone in them. And you take the same number pill every day. So number 5 always gets naltrexone, and number 12, he's always getting the fake pill. And you have a little booklet, and every time you drink, you put a little tick mark. You know, that's a beer, you tick the beer bottle, that's wine, you tick the wine, and blah, blah, blah. And you come back tomorrow, give me the piece of paper with the tick marks on it, I'll give you another pill and 25 bucks. And so they're motivated to come back. Clearly, they come back every day. At the end of 12 weeks, which is not a long time, but long enough, we break the code. That is, we break the code that says which numbers were the real pills and which numbers were the fake pills, because up to that point, none of us know. And if you look at the people who got the real medication, they consumed significantly less alcohol. Some of them stopped drinking. These people were not motivated to quit drinking. They were only motivated to get the 25 bucks. And so if you take individuals that really have no strong desire to quit drinking and you give them this pill every day, they drink less. It's like, oh, smokes. That's pretty good. And it is pretty good. It significantly reduces the craving to use alcohol. This would be a medication that you take every day. Much like you put your seatbelt on every day, not because you plan to have an accident this morning, but you know that it can happen. You take the naltrexone every day, not because you plan to relapse today, but you know it can happen. And so we have medications like naltrexone that reduce the craving, and we have medications like antabuse that make you sick if you drink, and you can actually use both of these together, much like you can use the patch and the gum and the Wellbutrin. There are a number of other medications besides naltrexone that help with cravings. There's acamprosate, there's baclofen, there's topiramate, there's gabapentin. There are a variety of these medicines that we can use, and so if for some reason you can't take the naltrexone, if for some reason the naltrexone doesn't work for you, you tried it, you didn't find that it helped, there are others that you can use. These medicines are covered by most of your insurance plans and by the provincial plans for BC anyways. I don't know about all of the other provinces. So we have medications for alcohol that can make you sick if you drink. We have medications for alcohol that can significantly reduce the craving to consume alcohol. And these are useful tools. Staying sober is tough. Getting sober is easy. You lock yourself in detox, you lock yourself in a place like this, and it's relatively easy to stay sober here. There's lots of support and there's no encouragement to relapse. But when you get outside into the real world, week after week, month after month, it's not so easy. There are people that are going to want you to drink or use and say, oh, come on, you haven't had a drink for 3 months. It's not going to hurt you to have one. And so you want to make the likelihood of your success as great as possible. Any questions around the alcohol? Yes?
So when these are broken down into enzymes, is that primarily your liver, kidneys, or?
Liver.
And then when you quit drinking, can your liver fully regenerate from the drinking down?
So there's a lot of questions in that question. Why do you have these break alcohol down enzymes in your liver? And of course the answer is because your body produces alcohol every day. How do you make alcohol? What do you need?
Fermentation.
Yeah, fermentation. So you need a sugar, a water, and a yeast. And you put all those three together and you'll get alcohol. And of course you have all three of those in your gut. You have wild yeast, you have water, and of course you have sugars. And so in your bowel there's a little bit of a microbrewery, and you produce very small quantities of alcohol every day. And this is why your liver knows how to break down alcohol. Okay? And those enzymes, if you drink a lot, will start to increase. Much like lifting weights, your muscles get bigger. And it's the same idea. Your liver gets better at handling alcohol, which is why when in the beginning, in 2 beer, you were drunk, and now it takes 12, because your liver's been lifting weights and it's gotten better at breaking down alcohol. As your liver does that, it suffers. There are other things it can't do, and it gets too big, overbulked. And it starts to scar up, and if that condition continues long enough, that scarring will become known as cirrhosis. And cirrhosis is just a fancy word for scarred up liver. Permanent. Once you get to cirrhosis, it's permanent. It ain't never getting better. That is, you've got a scar, and as you know from wounds, scars don't really go away. They improve with time, but they don't go away. But it's a process. It takes a while. We're all different. Okay, we all have different livers, and some people can get cirrhosis relatively easily. Most of us, if you have a normalish liver, it takes quite a while to go from I'm fine to I've got cirrhosis. 20, 30, 40 years of drinking before that happens. But it can happen sooner. It happens twice as fast in women. Sorry, ladies. We don't know why it happens twice as fast in women, but it happens twice as fast. Typically, male alcoholics will be in their 60s when they die from liver failure. Women alcoholics in their 40s. So it happens twice as fast in women. I don't know why. It just is. So if you quit before you get the cirrhosis, if you quit before you get that scarring, your liver will heal. It's only the scarring that is irreversible. It's a bit like walking off the cliff. If you stop before that last step, it's reversible. Once you take that last step off the cliff, it's irreversible. You have to destroy about 85% of your liver before it becomes irreversible. Quit drinking, doesn't matter at that point. You've done too much damage. So for most people, that takes quite a long time. And for most people, even though your liver may be significantly damaged when you get here and we do blood tests and we tell you it's out of whack, it will improve remarkably quickly. About 3 months and it's back to normal. The liver has tremendous capacity to regenerate. You can cut out half the liver and a new one will grow.
Okay, so with, I can't remember the name of it, benign cyst, hemo something, or?
Hematoma, maybe?
No.
Hemangioma?
That's it.
Okay.
Mangioma. Is that reversible?
No, but that's harmless.
Yeah.
So do you know what varicose veins are?
Yeah.
On the legs, you know, sometimes they're all twisted and they're not very pretty. Hemangioma is that inside.
So if it's only 0.5.
Doesn't matter. Doesn't matter. It's harmless.
Yeah.
No one ever died of varicose veins in their legs. No one ever died of an hemangioma in the liver.
Okay.
It's just varicose veins in your liver.
Okay.
And they're harmless. Totally harmless. Any more questions on alcohol? Okay.
Thank you.
So, no problem. So we've talked about nicotine and what you can do to improve your likelihood of staying cigarette free. We've talked about alcohol and some of the medications out there that can significantly improve your likelihood of staying abstinent from alcohol. And none of these pills are a cure. On their own, they won't work. But coupled with a recovery program and a whole bunch of other stuff that you're already learning while you're here, they can significantly improve the likelihood of you staying abstinent from tobacco or alcohol. We'll talk about opiates. So opiates, that class of drugs, codeine, morphine, oxycodone, hydromorphone, and of course the famous one on the block these days, fentanyl. There is no heroin out there anymore, it's all fentanyl. There's a lot of fentanyl. It's a very potent drug. You do not have to smuggle very much of it to bring in a lot of it. So in the old days, if you wanted to smuggle heroin in from Afghanistan or something, you know, you had a lot of dope, bricks of heroin that you had to smuggle in. It wasn't an easy thing to do. You had to figure out a way to hide it. People used to make these flat bricks and tape them to their body and do all kinds of things. But it was tough. And it was risky. There was a good chance you were going to get caught. Fentanyl is extremely potent. It's very strong. It's much more powerful than heroin. And carfentanil is 100 times more powerful than fentanyl. And so you do not need to smuggle very much to get a lot of dope into the country. And so most of it comes in through the mail and it's damn near impossible to stop. You know, a common smuggling technique is to take a laptop computer and the battery that's in there is about this big, and you take out 3/4 of the battery space and you fill that with fentanyl, and then you put a little cell phone battery instead, turn the computer on, it works. It's only going to work for 20 minutes, but it works, and the rest of the battery is fentanyl and it's easy to get in. So there's lots and lots and lots of fentanyl. When I started practicing medicine about 40 years ago, a point of heroin, it depends who you knew and where you got it, of course, but a point of heroin was about 35 bucks in 1980. Okay? $35 in 1980 is equivalent, it was a lot of money. Today, in today's dollars, it would be about $125. So, point of heroin was 35 bucks back in 1980, give or take, and just accounting for inflation, that's about $125 these days.
How much volume is a point?
Point is 100 milligrams, 1/10 of a gram, pretty small, pretty small. Nowadays, in today's dollars, a point of heroin, which is fentanyl, is $15 to $20. So, yeah, so it's like 10 cents on the dollar. It's crazy cheap. And the reason it's crazy cheap is it's so easy to smuggle and there's lots of it on the street. And so when there's lots of something, the price goes down. You know, when there's lots of lettuce, it doesn't cost so much at the grocery store. When there's lots of fentanyl, it doesn't cost so much on the street. So we have a huge problem with opiates. A drug that by inflationary standards should be 125 bucks a point is now 15 bucks a point. It's everywhere, and it's dangerous. And it's dangerous because it's so concentrated. So you smuggle in this laptop battery of fentanyl, now what do you do with it? Well, it's too strong. You got to dilute it. So you mix it with some cornstarch and some binders and some fillers and a little green food coloring, and you mix it all up, and then you press it into pills. What do you use to do that? Well, if you're a pharmaceutical company, you use good equipment that does it very accurately. But if you're a dope dealer, you use a magic mixer or a blender or some sort of machine that you have in the kitchen that'll mix everything up. And it works reasonably well. But it's like making chocolate chip cookies. Do they all have the same number of chips in them? No. Some cookies hardly got any chocolate chips, and well, I'll take that one, it's got 15. And it's the same thing when you make the dope up. Are all the tablets of fentanyl got the same amount? No. Some have very little and some have lots. And that's why we're having so many overdose deaths, because you cannot predict with certainty the dose that's in the tablet. Nor can the dealer or the manufacturer in the garage predict with certainty how much fentanyl is in the tablet. And, well, garage, basement, wherever they're made, you know. Yeah, they're not made in nice places. And so this is why we're having such a problem with overdose deaths. It's not that people are trying to kill themselves. If you're a dope dealer, it doesn't make sense to kill your customers. That's not good for business. You know, it's that no one can avoid having the odd dose that's way too strong. And so you can be a new user or a very experienced user, there's no way of avoiding it. It's like having a garbage can full of red Smarties, like millions of red Smarties in there, and you throw in a handful of blue ones, and you mix it all up. And now you blindfold yourself, you reach into the garbage can and you take a Smartie. 99 times out of 100, 999 times out of 1,000, you're going to get a red one. Because there's millions of red ones and only a handful of blue ones. But every so often, someone's going to get a blue one. And if you get a blue one, you drop dead. If you get a strong dose of fentanyl, you drop dead. And it's a huge problem right now. We've had problems with opiate addiction for a long time. Opium 100 years ago, heroin more recently, and now fentanyl. That class of drugs is all the same. An opiate is an opiate is an opiate. Beer, wine, whiskey is all alcohol. There are differences, but they're all the same. What works for beer works for whiskey. And so in the late 1950s, we began to use methadone, which had been developed as a painkiller to treat heroin addiction. And methadone works well for heroin addiction. Methadone binds on that part of the brain that likes heroin, and it takes away the craving to use heroin. A bit like nicotine patch binds to that part of the brain that likes nicotine and takes away the craving to use cigarettes. The nicotine patch is not really rewarding. You know, you get up in the morning, you have a cigarette, it's like, whew. You put the patch on in the morning, it's not, whew, it takes craving away, but it's not especially fun. And so when the time comes to let go of the patch, it's not that difficult. Methadone is not especially fun like heroin is, and so it takes away the craving and doesn't get you stoned. And that's the way it's supposed to work, and it usually works that way. Yeah?
Because I remember when I went to detox and there was a guy that was on it, but it looked like he was high every day.
Yeah, so that's the way it's supposed to work. You got to get the dose right. Okay, if you give people too much, they can look stoned every day, and that's not the goal. And then, I don't know, maybe he was using something in detox. I don't know. But yeah, it's dose dependent, so it's a tricky drug to use. You got to get the dose just right, but it has saved many, many lives because it has allowed people to stop shooting dope, shooting heroin, shooting fentanyl, whatever. About 20 years ago, we developed a medicine called buprenorphine, which is sold under the trade name today Suboxone. And this works in a very similar fashion. It blocks the part of the brain where the heroin or fentanyl would work. And by parking there, it takes away the craving. The brain says, oh, yeah, I got something in that parking spot. I'm okay. I don't feel like using dope. The Suboxone is much better than the methadone because you don't get stoned. It's a little tablet that dissolves under your tongue. The methadone is a liquid.
People were taking that in Phoenix area with you?
Yeah. Liquid would be methadone, and Suboxone is a little tablet that you put under your tongue and it dissolves. And Suboxone works really well. It works like methadone to take away the craving, but it's far safer. And it's far harder to get stoned on Suboxone. And because it's so much safer, we can be more forgiving with the rules around it. So if you're on methadone, you have to go to the drugstore frequently. Maybe not every day, but you don't go once a month and drink your methadone in front of the druggist, and then maybe if you're a good patient, you get to take a few days with you. Because Suboxone is so much safer, we can let people take a week or 2 weeks with them, and we don't worry about it because it's virtually impossible to die of a Suboxone overdose. It's real easy to die from a methadone overdose. But we have that 2 groups of drugs that we're using now, and we're expanding that because as I started off at the very beginning of this talk, telling you about the fentanyl overdose death, I mentioned that everything we've done, making Suboxone readily available, having Narcan kits for overdoses, having safe injection sites, all of these things we've done with the goal of decreasing the number of deaths that we're seeing, and it ain't working. The number of deaths is going up. I'm sure it would be going up much higher without these efforts. It's not that the efforts aren't doing anything good, but they're not doing enough. And so today we're exploring all kinds of things, and you'll hear in the news about hydromorphone or Dilaudid injection being offered and morphine being offered, and we're just expanding the list of things that we're making available to people who are addicted to opiates because we recognize that the risk of death is so high if you stay out there. But Suboxone and methadone are the 2 biggies that work for opiate addiction. Any questions on the opiate stuff?
I don't know if this is too off topic, but with regards to safe injection sites, what is, because I'm central Alberta, and a lot of people are really hard on the, let them die, safe injection sites are this, and they're the problem. What is your best way of having a intellectual kind of comeback to that, what would be your way of explaining that these are doing better than not having them?
Yeah, it's tough. So, my argument would be, are people going to use dope? To which everyone will answer yes. Okay, and is everyone that uses dope a bad dude? No. A lot of times it's your kid, your cousin, your nephew, your brother, your husband. It's all guys, didn't I say that? It's about 80% men that die from opiate overdoses. It's not that women don't die, but men are certainly overrepresented. So, I'd start by saying, look, people are going to use dope. And whether dope is illegal or legal, does it make a difference? Not really. People have been using dope forever. They're going to continue using dope. It's been illegal. We've been putting people in jail. The Americans put people in jail like crazy. We don't anymore, but the Americans still do. It hasn't done a damn bit of good. So you have to accept that people are going to use dope. And it's not too hard to accept that many people who use dope are pretty decent people. Do we want them to die? Should you have a death sentence for trying fentanyl? And I think most people to that question will answer no. And so how do we make it safer? Sure, we want to encourage people not to do it. We want to offer them lots of resources to stop doing it if they're already addicted. We've got Suboxone, we've got treatment centers, we've got detox. But recognizing that even with all of that, people are still going to experiment, how can we reduce the harm? And so that's what the safe injection site is. It's just, you're there, if you overdose, someone's there to help you. And we have these TV commercials now, don't use alone. Sadly, most people are dying in their bedroom, at home. They're using alone and they're dying. And if someone had been with them, they'd be alive. Because it's totally reversible. An overdose is totally, why do you die of an opiate overdose? What kills you? You forget to breathe. It's as simple as that. And so as you get stoned, you get more stoned, you get more stoned, now you're on the nod, you're not paying attention, you're getting sleepy. And if you get more stoned and more stoned, the part of your brain that's telling you in this room to breathe 15 times a minute every 4 seconds or so stops working. It's too stoned to work. And you forget to breathe. So you go from breathing 15 times a minute to 12, to 10, to 8, to 6, somewhere around 2 or 4 you're going to turn blue. And you just stop breathing in your sleep. That's how you die. So it's a really easy thing to reverse. You just keep people breathing until the drug wears off and you're fine. And you can make the drug wear off by injecting Narcan into them quickly. So it's a totally preventable death. And so this is the argument behind the safe injection sites. And we all had trouble with them when they came out. You know, gosh, do we want to encourage people to use dope? But it's not that. You have to get past that and sort of say, okay, people are going to do this whether we have safe injection sites or not. How can we make it safer?
CPR, mouth people what?
Yeah, absolutely. You don't even need to do the CPR because their heart hasn't stopped. Just mouth to mouth. Yeah, if their heart is still beating, all you got to do is keep them breathing. And you can do mouth to mouth. You can actually keep people breathing by doing CPR just a little bit lower, just in that diaphragm area. You can make air move in and out of the lungs, and it kind of makes sense when you think about it. You know, you push on, it's going to make air move in and out. Yeah, and call 911, of course.
So one breath about every 5 seconds?
Yeah, that'll do it. That'll do it. A little more if you can, you know, but that'll do it for sure. When you find them, they're deficient. They're really low on oxygen because they're almost dead, right? And so you got to catch up a little bit. One every 5 seconds is fine if you're well saturated, but you got a little catch up to do.
So turning blue is the biggest sign?
Well, starts around the mouth, and yeah, that's definitely a sign. Or just count the respirations.
Great.
You know, if they're breathing 12 times a minute, at the moment, they're safe.
What's a dangerous pulse rate?
Well, the opiates won't affect you. I mean, they kind of affect your pulse rate. As your breathing goes down and your oxygen level goes down, your brain sends out panic signals and says, we're about to die, do something, turkey. Unfortunately, turkey is too stoned to do something, but the heart rate will go up, a number of things will happen, and the heart rate will jump up to 100, 150, 200 in an attempt to try and get the oxygen moving, but there's no oxygen to move.
Great.
Yeah.
Okay,
So,
thanks.
yeah. Do you have a question back there at all?
Yeah, I was just wondering, the naloxone kits, how long do they last before they expire?
They've got an expiry date on the bottle, so maybe up to 3 years, depending on how recent your kit was manufactured, but they work well past that date. What's really tough on drug expiry is the terms of storage. And so, you know, if you've got a bottle of olive oil and you keep it in a cool, dark place, it lasts a long time. And if you stick it in the sun, it doesn't last so long. And it's the same idea with drugs. You know, it's depending how they're stored. So those dates on the bottles are kind of like the worst storage conditions. And they're often good. You know, if it says expires March 2019, it's not like in May the drug doesn't work, but it's gone from having 100% potency to maybe 95. And a year later it's down to 90. So if you have an expired one, don't hesitate to use it. It's not dangerous in any way. An expired drug is never dangerous unless it's tetracycline. That's the only drug that gets dangerous when it gets old. What they do is they simply lose their potency. Instead of 100, you get 90. Instead of 90, you get 80. But otherwise, it's way better than nothing.
I was just wondering, how is the new, I saw in the news that we have a new site where you can get your drugs tested. Mm-hmm. How does that work?
Well, I don't know, to be honest with you. You know, when fentanyl was first introduced into the street trade, it was a new drug and people didn't really want it. They liked their heroin very much. I'm used to heroin, I want that. And so they snuck it in. You know, it was like 50% heroin and 50% fentanyl. After a while, people were coming back saying, man, that heroin, that new heroin is really good. What is that? Of course, fentanyl works better than heroin. It gives you a better high. It's more fun. So now people want fentanyl. It's snuck in. That's how they got to try it with free samples, so to speak. But now that people have used the fentanyl, they like it. So I'm not sure how much value there is in testing the drug because I wanted to buy fentanyl. Of course it's there. You don't see, there's never, to the best of my knowledge, been any marijuana tainted with
I
fentanyl.
just heard about that the other day. And it looks
Yeah, you hear about it a lot, but it's not real.
Oh, okay.
It's an urban myth. There's no fentanyl in weed.
Okay. Oh, Sue was saying that. Yeah, it was Sue that.
I'll have to talk to Sue, and maybe she knows something that I don't know. But I'm not aware of any marijuana. Some cocaine can have fentanyl in it because the dealers want to make the cocaine more addictive. And so fentanyl is very addictive, and if you get used to their cocaine, you'll be even more addictive. But by and large, it's not sneaking into the drug supply like it did 5 years ago. Now it's open market. People are buying. Should have been, yeah. Well, it's not a great value. It's not a great value. Yeah.
So is fentanyl like a liquid or like powder?
Fentanyl's a powder as a rule. It comes in as a powder. Yeah. And so the other drug that works for opiates, and we touched on briefly when we were talking about alcohol, is naltrexone. So naltrexone is like Narcan. Narcan or naloxone, those kits for overdoses, are an injection. Naltrexone is the pill form of that injection, where you just take the pill. Naltrexone doesn't take away the craving to use heroin, it takes away the craving to use alcohol, but it blocks heroin. And so if you're clean and you want to stay clean, you take naltrexone every day or every second day, and if you do relapse, the drug does nothing. We're going to have a quick final word on cocaine and then we're done. We have nothing that works on crystal meth, in case you're wondering. Cocaine addiction, we don't have miracle drugs. What we are working on, what's really neat, although I don't know if we'll ever see it, is a cocaine vaccine. And so cocaine works because you ingest it, you smoke it, snort it, shoot it, whatever you do with it, it gets into your blood and your blood takes it to your brain and that's how you get stoned. But your brain has this neat thing around it called the blood-brain barrier. It's like an envelope around your brain. And if you think of pantyhose, you know, that material that stockings are made out of, things can get through there, but they're pretty tiny holes. Maybe water will get through, but strawberry jam won't go through because it's just too thick to go through those holes. The blood-brain barrier is a bit the same way. There's little holes that allow chemicals to get into your brain, but if the chemicals are too big, they can't get through these holes. Cocaine and alcohol and heroin are fairly small molecules, and they can get through those holes and into your brain. How vaccines work is we give you a little something and your body thinks it's been attacked and it develops antibodies. So we give you a measles vaccine. If you're smart, you had it. And if you bump into the real measles virus, you already have antibodies in you that attack that virus and attach to it and kill it. We can produce antibodies to cocaine so that if you ingest cocaine, which is a little bit of a molecule, these antibodies that we've given you attach to it, trying to kill it. Now, cocaine is dead already. It ain't going to get killed. But the result is that we've now created a molecule that is too big to get through the barrier. And cocaine can't get into your brain. And if cocaine can't get into your brain, you can't get stoned. So this works. We've done it. It works. Trouble is, it doesn't last. It only lasts a few weeks to a few months and then it wears off. So most vaccines will last. You get a measles shot, it lasts for decades. But this vaccine, unfortunately, we haven't been able to get it last longer. So maybe we've been working on this for a long time and no one solved the problem yet. But maybe someday you'll hear about a cocaine vaccine, and that's how that works. For today, the only medicine that we have that helps with cocaine cravings is a drug called modafinil. Modafinil, I don't know how everyone figures out these other uses, but modafinil was developed to treat narcolepsy. What the heck is narcolepsy? Yeah, narcolepsy sounds a bit like epilepsy. If you have epilepsy, unpredictably, you'll have a seizure. If you have narcolepsy, unpredictably, you'll have a seizure. But your seizure is not that, it's falling asleep. And so people who have they're gone. No warning, they're asleep. Really not a very good condition, especially if you're driving a car down the road. And so modafinil is used to treat narcolepsy. It prevents you suddenly falling asleep. And it's used a lot by truck drivers and shift workers to stay awake. It's a wakefulness promoting agent. And I guess one of those people that had been using cocaine to stay awake started using modafinil to stay awake, and lo and behold, the craving for cocaine went away. And so modafinil is a drug that you can take that will reduce cocaine cravings. And so if your drug of choice is cocaine, it reduces the cocaine cravings. Crystal meth is not all that different in many ways to cocaine, but it does not work for crystal meth or methamphetamine addiction. But it does help with cocaine addictions. And so if cocaine is in your armamentarium of drugs that you use, you might consider using modafinil to reduce the cravings. Once or twice a day. It is a wakefulness promoting agent, so you don't necessarily want to take it right at bedtime. So we've covered nicotine, we've covered alcohol, we've covered the opiate class, and we've covered cocaine. Any questions? Yes?
With regards to the one for alcohol, in combination with this, if you know, they're two and the same. Are they things that you can take together?
Yeah, that's good. Very good question. Thank you. Almost all of these can be combined.
Okay.
We'll look at each one, and it depends a little bit about what other medication you might already be on, but almost always we can combine these things, and so, yeah, we'll talk about that. Yeah.
This vaccine, it's still in the experiment.
Yeah, it works. Like, we've tested it and it works, but unfortunately it doesn't last. And so we've got to come up with you know, if it costs $10,000 a dose and it only lasts 3 months, it's not a very good investment, unfortunately. And so we're working on that. Yeah.
How long does the medication start working?
Well, it would depend on which one, but generally speaking, 3 to 4 days. 3 to 4 days. That's a good number for almost all of them. Some of them, like Wellbutrin for cigarettes, takes about 10 days to work, and some of them, like Antabuse, will work much faster, but generally a few days. We're not talking months or weeks, but rather days.
Say if you're a equipment operator, driver, whatnot, that modafinil, is it hard to get a prescription if, say, you know, I work 12 hours?
It should not be. It's not addictive. Modafinil is not addictive. Okay, and no, doesn't. No, it's okay. It doesn't show up on urine tests as a drug of abuse, and so it has benefit. Unfortunately, narcolepsy, or fortunately, narcolepsy is a fairly rare condition, and many doctors will never see a case in their whole career, and so many doctors won't be too familiar with modafinil. So you might have to do a little doctor educating. They'll be concerned that it's addictive, that because so many stimulants are addictive, but this one isn't. And so you'll have to educate your doctor a little bit, possibly, because many of them won't know about this, but it shouldn't be that hard to get a script.
And so this one should be pretty much instantaneous, right? It doesn't have to build up in your system,
No.
obviously.
Well, they all have to build up a little bit, so it's not instantaneous, but it's pretty quick. And again, 3-4 days.
If you're having trouble sleeping, you probably don't want to touch this stuff.
You don't want to take it too close to bedtime.
Okay.
You don't want to take it too close to bedtime, because it does tend, I mean, that's what it does, is prevent sleep.
Okay, thanks.
Yeah. Okay.
Can I get
Yeah, you can get one more question in, you bet.
on the antibodies testing for the cocaine? If they can't get through your brain barrier, blood barrier, do they go to the liver?
Yeah, it's only the brain that has that barrier. Yeah, the rest of your organs don't. No, we haven't found any harm with it. It actually looks to be it's intuitively a wonderful way to treat cocaine dependence. We just can't get it to last.
But it's a waste, right? Because you're not going to get high.
It's a waste because you can't get high. If the cocaine can't get in your brain, it can't do anything. For those of you who are suffering from terminally low nicotine levels, it's smoke break time. Thanks, guys.
Thank you.